Short-term and long-term effects of substance use and abuse. Each classification of these drugs has different short-term and long-term effects. Short-term effects last only for a couple days, hours, and short periods, while long-term effects can be felt for weeks, months, and even for a lifetime. The following is an overview of short and long-term effects of substance use and abuse. First are the gateway drugs. It is a comprehensive catchphrase for the often observed effect that the use of a psychoactive drug is coupled to an increased probability of the use of further drugs. In the Philippines, people below 18 years old are not allowed to buy and use gateway drugs. In most cases, using prescription drugs doesn't lead directly to addiction. However, abusing them can lead to habit-forming actions. Experts believe that these drugs put the brain on a collision course for addiction. There are two examples of gateway drugs, the alcohol and the tobacco. Short-term effects of alcohol are having headache and lightheadedness, slurred speech, slow body reflex, senses, and coordination. Overconfident, mood swings like depression, high spirit, and aggressiveness, nausea, and experience blackout or loss of consciousness. Long-term effects of alcohol causes to damage our body organs like heart, liver, colon, and brain. It may also lead to cancer and cardiovascular disease. Cirrhosis of the liver, poor study and work performance, paralysis, and loss of limb due to road accidents and other tragic events, and alcohol poisoning, which leads to common and eventual death. Short-term effects of tobacco causes stress, rapid heart rate, persistent cough, difficulty in breathing, halitosis or bad breath, sinusitis and otitis media, increased phlegm production, stomach problems, and weak physical performance. Long-term effects of tobacco causes asthma, atherosclerosis, and vascular disease, chronic obstructive pulmonary disease, cancer of the mouth and even throat, lungs, skin, and other body parts, hypertension or increased blood pressure, and last, a heart attack or stroke that can lead to a coma and death. Second are the depressants, also known as downers, suppress or slow down our central nervous system. It is also called sedatives, which are used to treat anxiety, mental disorders, and sleep orders like insomnia. Type of depressants are tranquilizers, a drug which are used to treat anxiety. Barbiturates, used to treat insomnia, sleep orders, and control seizures. And last is the hypnotics, are the most powerful depressants, and its function is to induce sleep, also for treatment of insomnia or for surgical anesthesia. Short-term effects of depressants on the body are slow brain function, which leads to a temporary memory loss, inhalants on our body are paranoia, heart attack, brain stroke, and brain damage, kidney damage, liver damage, and coma, which leads to death. Fourth are the narcotics, also known as painkillers. They also induce sleepiness and administered to patients with mental problem. It is also given to cancer patients to relieve severe pain. Narcotic drugs include cocaine, heroin, and marijuana. Short-term effects of narcotics on our body are drowsiness, euphoria, loss of appetite, vomiting, nausea, muscle cramps and pain, chills and shaking, weight loss, difficulty in sleeping and breathing, inflammation of the veins, and panic attacks. Long-term effects of narcotics on our body cause development of diseases like hepatitis, tetanus, and HIV/AIDS. Due to needle sharing and overdose, may lead to coma or death. Next are hallucinogens. It creates hallucinations. Hallucinations distort what is real, and everything that the person sees, hears, and feels are the opposite of reality. Lysergic acid diethylamide or LSD, psilocybin, and mescaline are some of the common hallucinogens. Short-term effects of hallucinogens on our body are euphoria, hallucinations, poor judgment of time and distance, inability to sleep, loss of appetite, which lasts up 10 hours, nausea, poor body coordination, feeling super strength, increased blood pressure and heart rate, aggressive behavior, memory loss, and slurred speech. Long-term effects of hallucinogens on our body are flashback. Efforts of the drug comes back after a long time of not using it. Increased blood pressure, brain damage, psychosis, and coma or death. Last are the inhalants that are found in common household chemical products. Inhalants are huffed or sniffed. The effects of inhalants are similar to the effects of alcohol intoxication. Short-term effects of inhalants on our body are euphoria, slurred speech, poor coordination, dizziness, and nausea, feeling of lightheadedness, foul breath, hallucinations, and delusions. Long-term effects of inhalants on our body are loss of hearing, uncontrolled muscle spasms, brain damage, nerve damage, and bone marrow damage.